Dave, thanks so much. Vice President Joe Biden's son left the hospital earlier this week after suffering what doctors said was a mild stroke. The Delaware Attorney General is only 41 years old. Proof it is never too early to get stroke smart. Joining us with more, vascular surgeon Dr. Albert Sam, who was recently named a national spokesperson for the American Stroke Association. And this Thursday, he shares his vast knowledge with you. He joins us now with more. Dr. Sam, great to see you.
Always good to see you. Good morning.
Thank you. Well, we read the story about Joe Biden's son. He's younger than you and I.
He's 41 years old, and what we're seeing now, stroke is affecting even younger and younger Americans. Beau Biden, like I said, 41, but you know, Baton Rouge has been hit hard. We've just lost Kurt Bennett, civic leader in our community, to a tragic stroke, and you know, our Chief Justice, Kitty Kimball's also had a stroke. But we're seeing that younger people are having strokes now, and it's something that we have to get the word out, because education is the key to prevent these.
What's behind all this?
Well, in Louisiana, our lifestyle is such that we lead a sedentary life, and you know, a lot of us don't go to the doctors the way we should, so we don't know the signs or symptoms of stroke. Suddenness is the key. A sudden loss of vision, a sudden change in, say, how you can function with your arm, a sudden inability to speak. These are medical emergencies, because many strokes can be prevented, but most of the signs are ignored. So we're just trying to educate the population, get the word out, and we've partnered with the Baton Rouge General. We're going to do that on Thursday from 5:30 to 7:30. We're going to have stroke screening. We're going to be taking BMI, body mass index measurements, taking blood pressure. We'll have some stroke survivors there, and mostly just get the word out about the things to look for to help prevent stroke.
And you're going to do some tests, and the tests have come a long way. They're really non-invasive, right?
They are. Ultrasound is used. We just rub some gel on a probe, and we kind of scan your neck to see if you have some of the blockages that can cause stroke. 30 to 40% of all strokes can be caused by blockages in the neck that can break off and travel to the brain. Usually there are no symptoms. If you're lucky, you may have one, but usually you won't before a big stroke.
Yeah, you know, you mentioned Kurt earlier, and it's just heartbreaking, and we all miss him. So, but look, here's a guy who was active. I don't know what his workout routine was, but certainly not overweight, very involved with his children's life, very involved in the community. I mean, here was a guy that you would not have thought was at a high risk.
You have type A people, and then you have type AA+ people. And unfortunately, those people ignore their own health because they're so into caring for other people. And we just have to take time to have people step back, go to the doctor, get your numbers checked, know your cholesterol, know your blood pressure to help prevent these things.
What's the most dangerous part when it comes to stroke? Is it high blood pressure, or is it cholesterol?
Actually, by far and away, it's smoking. That's number one. Now, in Louisiana as a whole, that pretty much predisposes you more than the others. But then after that, long-term cholesterol elevations, which can deposit on the lining of the arteries to cause blockages, diabetes, which may be unchecked. In the African American community, oftentimes it's high blood pressure. You know, over time, that high blood pressure thickens the arteries, which can block all of the blood flow to the brain, causing stroke. So,
and how does smoking play a role in that?
Smoking, the cigarettes that are in the toxins in cigarettes can cause the lining and the what's called the basement membrane, which is the reinforcement area of the arteries, to thicken and cause arteries to become more active and spastic, which can cause a reduction in blood flow to the brain.
And we know how much we need all the blood and the oxygen to our brains.
That's it. The brain is not tolerant to a lack of blood flow.
Gotcha. Dr. Sam, it's what a pleasure to have you with us this morning. Congratulations on being the national spokesperson.
Thank you so much.
That's really wonderful. I mean, Baton Rouge doesn't often have a national spokesperson in our midst, and so congratulations for that.
It's been a humbling honor. Thank you.
We're proud of you.
For
more information on the seminar Thursday, check it out, 763-4281, or head to